The CDKL5 disorder is a rare genetic epilepsy. It's due to a mutation in the X chromosome, which is why we see girls predominantly suffering from this condition, though there are some rare boys who also have this condition. And it affects the way the brain functions due to the defect in the protein, which is caused by the genetic condition. This leads to a number of problems related to brain function, and that is global developmental delay and epilepsy. CDKL5 disorder is not a single organ disorder, that it doesn't just affect the brain. The young children can be affected by problems with the heart, breathing, gastrointestinal problems, which also need attention and care. And that makes it very complex because, one, it is a rare condition. Secondly, it affects a number of systems in the body. And thirdly, not a lot of people know about it. It's been only about 12 years since it was discovered. The diagnosis is becoming easier because of the availability of genetic testing, and it's cheaper now. And also the professionals know a little bit more about this condition, and therefore they're able to recognize it more easily. There is a real importance in diagnosing conditions like CDKL5 early, because it then leads to better management and better interaction with other professionals, as well as the holistic care of the child with CDKL5 is better deliverable once the diagnosis is made. The problem in CDKL5 disorder is it's not very responsive to anticonvulsant medication. The seizures which present are difficult and quite challenging to treat. And often we find that young children are put on a number of medications which may be correctly put on because of the nature of the seizures, but there's a serious risk of over-medicating because the epilepsy is very severe and doesn't respond to medications. So we have to think about other options for treatment, like ketogenic diet or vagal nerve stimulation, or even high-dose pulse steroid in that case. Yes, I think the awareness is certainly improving, not just among the pediatric neurologists as a community, but also among pediatricians. The crucial part in increasing awareness has been CDKL5 UK and patient support organizations, which are not just increasing awareness, but also helping support families in dealing with this very difficult condition. So our drive is to increase knowledge about it and try and have a system of care which allows all aspects of care required to be delivered at a single point, which is where we're thinking about the Center of Excellence, which is, I think, the way to go forward in dealing with rare genetic epilepsies like CDKL5 disorder.